Global health researcher and bioethics specialist Dr. Anant Bhan joins me now from Bhopal. Doctor, infections in India topping 50,000 a day, more than double the number less than 2 weeks ago. What is behind this surge?
Thank you for having me. Yes, it's becoming a bit of a worrisome situation. We've had an extended period where the number of cases were going down, but for the last few weeks, the cases have begun to rise again. It's probably a bunch of things happening together. One, there is still a significant section of the population which is susceptible, and that is proved by our seroprevalence surveys which have been carried out. Two, I think there has been a lot of fatigue, and a lot of people are not following public health measures like masking. There has been a lot of social gatherings which have been happening as the economy opened up, and unfortunately, it has led to the spread of the infection. And the third factor likely is also that there might be some mutations and variants which could be more infectious in nature, which are causing the spread of infection.
I heard somewhere that actually I read when I was doing my research that there are nearly 800 variants of concern in India. That many? 800 seems like an awfully high number.
Yeah, I mean, the numbers seem high, but globally, that is the truth about the virus. The virus mutates. There are variants. So this is something which obviously needs more tracking, because even in India, as you are rightly saying, there have been quite a few variants already reported. So this is good quality genomic surveillance, which tells us that. But the evidence indicates that it's more the lack of adherence to public health measures by a significant section of the population which is driving the spread. As long as people take precautions, it doesn't really matter if it is a variant or if it's just a normal kind of virus. You could still prevent infection, but obviously it's not happening.
Understood. Dr. Bhan, India is now holding back the export of the AstraZeneca vaccines, which is produced in India. What does that mean for Indians waiting to get vaccinated? And what does it mean for the rest of the world that has been counting on India to export these vaccines?
Yeah, so India is a major manufacturing hub for vaccines globally, including for COVID-19, has this, dilemma that they have to obviously satisfy domestic need, and yet at the same time also ensure that they are exporting, especially to other low and middle income countries, which depend on countries like India to supply low cost and quality vaccines. Now, as the number of infections have been rising, I think there's also pressure domestically to try to enhance the vaccine coverage and get a larger section of the population vaccinated. And yet at the same time, there is a lot of demand for the vaccines abroad as well. So I think in the absence of production being ramped up in the near future, there's going to be always this pressure of how to ensure that you are able to produce enough vaccines which can satisfy India's own needs and also export. And I hope that the manufacturers and the government can find a way out because, again, as you know, there is a global need for these vaccines. And the sooner we vaccinate more individuals, perhaps the faster we'll be able to address the pandemic spread.
And where do things stand with India's domestic vaccine, Covaxin, I believe it's called? How effective is it, and is it already out in the market?
It is already out in the market. It is actually one of the two vaccines which is being used in India in a widespread manner. It is still the AstraZeneca version, which is called Covishield in India, which is the more widely being used because the production is higher for it. But Covaxin is also being now used in the program. The phase 3 efficacy data is not yet out, but the phase 2 data and the evidence so far on safety is pretty positive. But hopefully we'll know more in the near future with phase 3 efficacy data also being published.
And very quickly, Dr. Bhan, your take on how the government of Narendra Modi has handled this health crisis?
Well, they've put a lot of focus on trying to respond to the pandemic, and it's been now more than a year trying to address this as a major priority. A lot of the steps initially which were taken, like the lockdown, which was one of the most stringent and the longest in the world, certainly had helped keep the infections low. There were concerns around testing not being adequate in the initial period. Now it's much better. The supply of kits, etc., is now much better for testing as well. But again, for a country of our size and population, there are going to be a lot of challenges. And now with the resurgence in the number of cases, both at the central level, with the union government and at the state level, there is a requirement to take stock on a daily basis and ensure that we prevent a situation like last year where there was a lot of pressure on the health system and hospitals full of COVID-19 patients.
Right. All right. We'll have to leave it there. Dr. Anant Bhan, thank you so much.